Well, welcome everyone, and thank you for joining us for today's webinar. My name is Sophie Teague, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones and Bartlett Learning. For those of you who are not familiar with Jones and Bartlett, we are a provider of instructional assessment and learning performance resources for the secondary, post-secondary, and professional markets. And we specialize in the areas of health and safety. And today we're going to be talking about some new initiatives underway with community colleges in public health. We have two featured presenters today, Dr. Richard Riegelman and Dr. Kay Perrin, both of whom are very actively involved in these and other initiatives to encourage undergraduate public health across all higher education institutions in the U.S. I'm going to introduce each of our presenters in turn, but before I do, I just want to go through a few quick housekeeping items. First off, your lines have been muted. However, there will be a chance for the lines to be unmuted to ask questions. There's going to be two opportunities to do that today. First, we're going to hear from Dr. Riegelman. He's going to give us an overview of what's happening with community colleges in public health, and we'll open up the lines for questions just after that. And then following that, we'll hear from Kay Perrin, who will talk to us about the book that she's just finished writing. That's going to be the first in a series of texts designed for health navigation education. And then following Kay's presentation, we will again open up the lines for questions. We have an operator on the line, Charette is her name, and she's going to assist with the Q&A pieces. She will manage the lines, and you'll be able to press *1 if you want to ask a question, and she will unmute your line. I also encourage you to type your question into either the chat box or the Q&A box, which can be found on the right-hand side of your screen. If you're not seeing those boxes, you can just mouse over the top of your screen and click on either chat or Q&A, and those boxes will appear. And I encourage you to enter your question in at any time during the session. During the presentation, I'll hold on to the question, and I'll read it aloud when we get to the Q&A piece. I also want to let you know that the entire session is being recorded, and following the webinar, I'll send a couple of follow-up emails, first with a copy of the slides and links to other resources. And then as soon as the webinar recording is available, I will also send around a link to that so you can watch it in its entirety at any time that's convenient for you. So at this point, I'm going to introduce you to our first presenter, Dr. Riegelman. But before I do, I would like to ask a poll question, which is how many of you are either planning a health navigation associate degree or certificate program, or you may have one already. And if you could just answer yes or no to that. There is, on the right-hand side of your screen, you should see a little button for feedback. That looks like this button here. Simply click that and select yes or no, and we'll be able to see the results from that. And while you're doing that, I'm going to go ahead and introduce you to our first featured presenter, Dr. Richard Riegelman. Dr. Riegelman is Professor of Epidemiology Biostatistics and founding Dean of the George Washington University Milken Institute School of Public Health. He's been a leader in undergraduate public health education for over 10 years, working with national organizations, including the Association of Schools and Programs of Public Health, the Association for Prevention, Teaching, and Research, and the Association of American Colleges and Universities. He's also the editor of our very successful Essential Public Health book series. That's Jones and Bartlett Learning. This is a full series of 20-plus titles aimed at undergraduates, and we will hear more about that today. And he's also the author of the key title in the series, Public Health 101. So with that, I will now turn things over to Dr. Riegelman.
Well, thank you, Sophie. Let me start by saying how much I'm enjoying working with the community colleges. It really, the commitment to students and the commitment to community is real and really, I think, dovetails beautifully with public health. There are a number of things that I want to talk to you about today. Let me just quickly outline them, and then we'll go through them. First, I'd like to talk to you about the rapid growth, the exponential growth in bachelor's degree programs in public health over the last decade, and the kind of growth that's occurred in the last decade we hope will occur in the coming years in associate degree programs. I'd then like to turn attention to the Community College and Public Health Report, which lies at the heart of much of what we're going to be talking about. And that was produced by the Association of Schools and Programs of Public Health, as well as the League for Innovation in the Community Colleges. And as many of you know, the League is a key organization that represents almost 900 of the 1,100 community colleges. So we're going to talk more about what the League is doing. The report itself includes two curriculum frameworks that we're going to talk about and look at. One is called Public Health Generalist and Specializations, and those specializations include health education, health administration, and environmental health, and so we'll talk a little bit about that. The second framework is a new framework for health navigation education, and there is a real activity that is kind of owned and operated potentially by the community colleges, and we're going to talk about how that might work. These I want to be sure you understand when we talk about health navigation. That's the titles that we've given by the League and by the schools and programs of public health to a educational framework that leads to a number of jobs: community health worker, patient navigator, health insurance navigator, and as we'll talk a lot of other titles as well. Then we'll talk a bit about what now that this effort is really underway, we're going to talk about what some of the efforts of the League for Innovation at Community Colleges, has done last year and is now doing this year and into the future. Then I'll turn my attention to our new series, the Jones and Bartlett Learning Health Navigation series, and show you how a number of the books that are already existing and are being developed fit nicely into the development of certificate and programs as well as associate degrees. And finally, we'll leave you with a number of resources to show you what is available. All that before I turn it over to Dr. Perrin to talk about her book. So let's start by briefly looking at what's happened with bachelor's degrees. I think you'll see over the last decade it really has been an exponential growth. And you'll notice that the green area reflects public health generalists, and that area is really built on what we've called the educated citizen in public health that the Association of American Colleges and Universities has been instrumental in leading. So that green growth is really quite impressive. I guess it's teal colored under that is health education, and that's also been an area of rapid growth. And the two under that are actually both different forms of health administration activities, so that there has been enormous growth in a whole variety of series and specializations within public health at the bachelor's degree level. And the bachelor's degree, this is a reflection of the current state of where things are, where the programs are. And I think they map very nicely with the populations. They're all over. It's east, west, south, midwest. It's really, it's become a truly national phenomena, and that's been very exciting to see that. Now, I bring this up initially because I think one of the things I hope that you'll do as you develop and think about your programs is to connect with with bachelor's degree programs, at least for the transfer degrees. And the link here, when you get the PowerPoints, I suggest you look at this link. It's all this data came from that site, and you can find over 300 bachelor's degree programs organized by state and by the name of the college or university, as well as how many graduates they had in the most recent year. So I think you'll find that to be a very good resource for you if you're trying to find out what's going on in your immediate vicinity. The second piece that I want to talk to you about is the community college in public health efforts. And despite the enormous growth at the bachelor's degree level, it hasn't happened yet at the community colleges. It's really just beginning, but there are advantages of being able to develop things and really try to understand what the needs are out there. So the community college growth in public health and in health navigation is really just beginning to take off. And I think one of the big propelling forces has been the effort by the Association of Schools and Programs, as well as the League for Innovation at Community College, to put together a real effort, a joint effort, to try to make this happen from both the public health area and the community college area, and how to work together to make it a smooth transition between bachelor's degree programs and between associate degree and bachelor's degree programs. Now, at this point, the League for Innovation in the community college is taking a very important role in this, and we'll talk more about the kind of things that the League is doing in just a few minutes. There are two basic approaches, frameworks that are included in the report. And by the way, this report, as well as the guide, what we call the guide to public health and health navigation education, both of those can be downloaded from this webinar, and I strongly suggest that you do that. That provides quite extensive advice and from the League as well as from the public health end. So what this report proposes is two curriculum frameworks, both of them designed to be 30 credit hours, 30 semester credit hours, about a half of an associate degree or a certificate program of 30 credit hours. And we did two frameworks, one called Public Health Generalist and Specialization, and that one was done, and that's designed for transfer to bachelor's degrees. So to make that work, we tried to connect the national organizations that have been working at the bachelor's degree level so that to facilitate the articulation of these programs and to so that there was really, so we had the advantage of starting fresh and really being able to say, well, how should we articulate these programs? And so we have the Public Health Generalist, which follows the AAC&U Educated Citizen and Public Health model. We have Health Education, which is done in collaboration with the Society for Public Health Education, or Sophie. We have a model for health administration, which was put together in collaboration with the Association of University Programs in Health Administration, AUPHA, and then we have the environmental health model, which is done in cooperation with the Association of Environmental Health Academic Programs, AEHAP. And that's so this is a key strategy, I think, of engaging these professional organizations that work at the bachelor's degree level, and to try to be sure that the kind of programs that we're recommending will work for to articulate with the bachelor's degree. The second framework is this new framework, this health navigation framework, which we think is going to be so important because there's such a need out there, and there's increasingly lots number of jobs out there. In fact, one of the things that makes things a little bit complicated is there are so many job titles. We've identified over 100 job titles that people are looking for these kind of skills. But the three big ones are community health worker, patient navigator, and health insurance navigator. What's made viable activity now is that there are new sources of funding for jobs, and they include the 30-day readmission rule for under Medicare, which has really brought the hospitals into this framework. Medicaid is providing funding for these positions. Obamacare health insurance navigators and the community health centers all are providing opportunities that weren't there just a few years ago for these kinds of positions. And we can talk more about that. The salaries, I think, are very appropriate for initially for graduates of associate degree or certificate programs, and there are already channels for advancement. So the basically the next thing I want to talk to you about is what the league is doing and has done, and then we'll talk about the details of these programs and the potential books that might go with them. The league, this report was approved in late 2014, and in 2015, the league really stepped up and said we need to get this the momentum going for developing these programs in community colleges. So in 2015, early 2015, they put out a call for planning, and that's been a common practice of the league in terms of facilitating innovation. They have found over 20 community colleges that were interested in developing these programs, and we put on 6 webinars in collaboration with the organizations that we've been working with, and so that there's lots of material on webinars specifically, and those webinars will be available shortly on the league's new website, and the URL for that is below that. They have a beautiful new website which was being phased in over the next few weeks, and you'll find I would go to it, but I'd go back to it when it's more fully operational, and you'll find lots of things on the league.org/CCPH, Community College and Public Health. There are now a number of new initiatives that are happening in 2016. The first thing that happened early in January was the publication of the Guide to Public Health and Health Navigation Education in Community Colleges. That's what we're calling the Guide, is also available for download with this webinar, and it provides detailed guidance for those who want to implement either the public health or the health navigation programs. One of the things that's about to happen is that on March 22nd, there will be at the innovations meeting that the league runs, their big annual meeting, there on Tuesday, March 22nd, there will be a plenary session for the entire meeting of well over 1,000 people. That's going to include recognition for the recognition awards for new programs. And in addition, early this month, a journal of Sophie, Pedagogy of Health Promotion, put out a full volume, a full issue, a special theme issue on public health and health navigation education, and that can be downloaded at the URL that you see there that you'll get with your PowerPoints, and it can be totally downloaded free of charge during the month of March. So for those who are interested in getting the entire issue there, I would suggest you do that after you get the PowerPoints and then in the next few days. The innovations meeting, as I said, will have not only a keynote address and a keynote and a plenary session, but it'll have 2 breakout sessions, one on public health education and one on health navigation education. So what you're seeing at the league is doing is very parallel with what we're talking about today. Plans for the future include a proposal for what might be called Technical Assistance and Consulting, or a TAC directory. And that directory would be aimed at linking community colleges and bachelor's degree programs. We have interest from Sophie, from ASPPH, and as well as the environmental group, and we hope that these groups will encourage their members to be available to provide advice and consultation, both technical assistance and assistance with articulation for community colleges that are interested in developing programs. It's nice to see that the bachelor's degree programs are very engaged and are looking for ways to connect, and we hope that we can provide some of that through this TAC directory, which will also be part of the new league website in the coming months, we hope. Let's talk now about the book series, the new Jones and Bartlett Learning Health Navigation book series, and then I'm going to try to show you how the recommendations for public health generalists, as well as the health navigation, utilize a number of the books. The Jones and Bartlett, the Health Navigation is a new series. It's will be hot off the press this summer, and you're going to hear from the author Kay Perrin in a few minutes about principles of health navigation. It'll be the first of 4 books. And what's the key is these books together will cover all of the learning outcomes recommended in the report and in the guide. So we see this as really being able to provide a comprehensive set of 4 books that will cover the health navigation expectations. The remaining 3 will be published in 2017, and in a few minutes I'll show you what those will look like. So there'll be one book, Kay's book this summer, and then you'll see in 2 others in the spring, and the final one in the fall of 2017. Now there are 2 other books that are coming out in the not too distant future from Jones and Bartlett Learning that will also fit into this. One is Foundations of Health Communication, and the other is Personal Health, a Population Perspective. And we'll also show you how these fit into the overall picture. Let's walk through now what is being recommended in terms of content. The reports provide lots of detail. The guide actually provides learning outcomes for each of these courses, and so you can really see the frameworks for these texts, and also for what might become syllabi for you. The first is that there needs in both the health navigation programs and in the public health generalists and specializations, there was quite good consensus that we need foundational courses. And that's where this the personal health with a population perspective would come in, and that's a course that many schools have personal health courses, but this is a little different in that it really has the population perspective. Then there would be foundational courses, Public Health 101, which is available, and also Fundamentals of Health Communication. So those 3 courses are courses that not only might be taken by people who are going to go on to take an associate degree, but these are very relevant courses for almost all undergraduates, and certainly should be relevant to other health professions, to nursing, to health sciences, and I think you'll find that these will be a good foundation and good ways to introduce a much broader audience to public health and health navigation. The second piece is for the Public Health Generalist program, and that is really there are 3 areas. Remember that the 3 areas where the bachelor's degree specializations have developed are health education, health administration, and environmental health. And Jones and Bartlett Learning have now texts, including Essential Public Health Series texts, that address each of these 3 areas. Now let me talk about the Health Navigation Series, because these are the 4 books that will really provide the curriculum for a health navigation specialization. Either associate degree or a academic certificate program, perhaps a 30-credit program. As I said, Kay Perrin's book, Principles of Health Navigation, you're going to hear more about, and it'll be out in time for the fall courses. Secondly, Nancy Niles, who is a well-established Jones and Bartlett Learning author, will be producing a book called Navigating the U.S. Health System, and she has a great deal of expertise in teaching. Many of you may have already used or heard about her books. They're very approachable, and I think will fit very well with your student body. The third one, which will also come out in the spring of 2017, is a new book by Alexis Posen and Jim Stimson on navigating health insurance. And we certainly looked around and about what's needed there. And this is a book that looks at health insurance from the patient perspective, instead of most of them that look at it from the provider perspective. And health navigation is about helping patients and seeing the world through the patient's eyes. So I think you'll find that that's a very good way to do that. And finally, to put it all together, we have Christina Zarkadoulis will be producing a book which will be including a number of case studies that will hopefully be a good way to synthesize a program at the end. And her book will come out in the fall of 2017, but which will be hopefully provide you with a text that could be used as the culminating course for the health navigation series. In addition, we've built into these frameworks electives, and that's true of both the public health generalist program as well as the health navigation. And there are lots of opportunities for electives. A number of them that we've suggested are public health preparedness. These are all ones that there are well established now, Jones and Bartlett Learning Books. Public health preparedness is an area where there certainly are jobs and is a good area for an electives. Health, culture, and diversity. I appreciate very much the type of diversity that exists at community colleges, and we want to encourage more of that in public health. And I think that that's a book that maybe I think people will find quite useful for that. And then, of course, health information systems and technology. We can't talk about public health or health care without talking about information technology today. And that textbook, which came out last year, is really an excellent way to introduce students to health information systems and technology. Global health, which is certainly one of the big sellers in the Essential Series, is a wonderful book with resources for taking the broader perspective on public health. And finally, Health Law and Policy, brand new third edition, which has lots of useful resources to help you teach in that area. So those are areas that you might add on for electives for people. I want to leave you with kind of giving you a sense of the resources that are available. Here are 5 websites that have just all kinds of information, and one of them, Sophie's going to tell you a little bit more about the brand new health navigation website that she's put together. The Jones and Bartlett Learning have just finished. There are other useful informations that you'll have available through this, and they're all either will be available on the website or delivered to you by email. One is a flyer on the different books in the Essential Public Health series. The second is a flyer on the critical component elements for a major, and those of you who want to articulate with bachelor's degrees might find that to be a useful resource. And then there also are the materials that I've just referred to. There's a one-page summary of that will allow you to understand the relationship between the different textbooks and the recommendations for these programs. And finally, we have a resource sheet for you on undergraduate public health resources, both at the undergraduate, both at the bachelor's degree and the associate degree level. There are now a large number of publications that might be useful to you, and there are this sheet contains links to many of those. Finally, a resource that you're going to hear more about, which is the Health Navigation blog that Kay Perrin has put together with Jones and Bartlett Learning, and a number of the authors in this series will be contributing to that, and it's already much of it. Sophie will tell you how the existing blog is already available. That's the key elements that I want to talk to you about, and from what's happening with the bachelor's degree, the report, the basic frameworks, what the League's doing, and what's available through Jones and Bartlett Learning. So before turning it over to Kay Perrin to tell you about her book, I look forward to hearing some questions and being able to respond to you.
Great, thank you, Dr. Riegelman. And just as a reminder to everyone, if you'd like to ask your question out loud, if you simply press *1 on your telephone keypad, our operator, Charette, will queue you up to ask a question. She'll unmute your line in turn, or if you want to type your question, you can do that as well. You can use the chat box or the Q&A box, which is on the right-hand side of your screen. So I'll give people a moment to do that. And then while we're doing that, just to give the results of the poll question about how many of you are currently offering or potentially planning to launch a health navigation certificate or associate degree program. We have a little bit over 50 participants on the line, and some of you did respond. We have 12, actually I think a few others responded in the Q&A section, 12 plus that responded yes, and we have 5 who responded no, so that's fantastic to see, and you can continue to answer that question if you'd like. In the meantime, I'm looking, I do see a question coming through on the chat, but let me first turn to Charette and ask if there are any questions on the line.
And there are no online questions.
Okay. Great. Well, Dick, we do have a question here for you. Why do you think there will be rapid growth in public health and health navigation education in community colleges in the next few years?
Well, I think what's in the last two or three years, things have changed dramatically. I think people have seen the example of what can happen in the bachelor's degree level when there's collaboration between public health organizations and undergraduate organizations. In that case, the Association of American Colleges and Universities. And so this, we now have the in a sense, the endorsement or the engagement of the public health organizations that are working at the bachelor's degree level, the Association of Schools and Programs of Public Health, the Society for Public Health Education, the Environmental Health Group. They're really engaged in trying to reach out and see what can be done to connect. In addition, we have the engagement of the League for Innovation in the Community Colleges, which I imagine most of you have had contact with, some hopefully extensively. It's a wonderful organization, and they are really working to develop this area. This is going to be an ongoing activity for them. There are going to be ongoing awards, and I think that what's unique now is that we have a model that's a consensus that is developing on what education might look like, and we have the organizations engaged. I think we learned that these things don't just happen spontaneously, that there is a need for national collaboration, and I'm pleased to say that I think that's coming nicely, and so we would certainly hope to see some nice growth over the next few years and quite rapidly in many of the areas.
Great, thank you. We have another question here. What is the success rate of getting these programs implemented at the community college level?
That's a good question. I'll come back next year and maybe we'll give you a fuller answer to that. What we have is a planning process, and we have 6 programs that will be, a large number of programs participated in this and are doing plans. 6 of them will receive special recognition awards on March 22nd, and many of them are starting the programs in the fall of 2016. So success rates of starting is still hard to determine, but we are seeing that having these national frameworks makes it easier to get approval. And as I'm sure all of you very much appreciate, in order to get approval, you need to show need, and you need to show jobs. And I think the 2 things that we're now able to show much more, and there's lots lots of information if you need it on transferability to a bachelor's degree and jobs out there increasingly for health navigation. There's Department of Labor projections, and there's quite encouraging that the jobs are increasingly out there. So I can't tell you the success rate yet, but that's the kind of thing we'll see over the next year. But all signs are really quite promising.
Great, thank you. And sort of as a follow-up to that, are you aware of the LAH3C federal grant that is paralleling this type of program?
I don't have a lot of detail on the federal grant processes. We are finding that these programs can quickly generate revenue because what they do is they fit into general education, the initial courses. They fit into education of nurses and health sciences, allied health professionals, and the initial coursework is really quite popular. The kinds of initial courses, overview courses in public health, health communications, personal health and wellness are all big courses that can be offered as part of these programs to a large audience, certainly health professional audience, but also as part of general education. So we found that most programs, it's wonderful to get outside support for these, but most programs can generate the initial revenue by offering these courses to a wide audience.
Okay. Is accreditation available for these programs, and will articulation agreements require the program to be accredited?
Yep. The accreditation in the Council on Education for Public Health is the accrediting organization in public health, and their accreditation is at the bachelor's degree level. And they offer, as of 2014, they're just beginning to offer now and just having their first round of approval of bachelor's degree accreditation at the for public health programs. And so the accreditation is really not at the anticipated in the immediate future at the associate degree level. On the health navigation side, we're talking about a relatively fluid situation. There are a number of states that have begun to offer a certification at the state level. And so that's a complicated because each state is different. But yes, there are some certification processes that are going on at the state level.
Great, thank you. I have a question here specific to Minnesota. Minnesota has a large community health worker network. Can the Health Navigator Associate's degree, I guess, offer students different content or prepare them for different positions than the community health worker? What are the potential, or would potential Health Navigator graduates have a network?
Well, the community health worker is, we see it as one of multiple jobs that these degrees prepare people for. The way we look at it is that there really are three different things that are needed. One is to help people in the community, help people with prevention, and that's the community health worker approach. Then there are the whole issues about how to get through our amazingly complex healthcare system. Everything from getting appointments to understanding the follow-up that's needed and the arrangements that are needed, post-hospitalization, and those are often the patient navigators. And then there's our almost equally complicated health insurance system, and people so that the health insurance navigators. The community colleges have felt that for people that it's best to be able to do all three of those jobs, all three of those roles, and that many of the jobs in the future are going to combine them. And certainly that's what the patients need. They need help in all those dimensions, from the prevention through the the navigating the system through the health insurance network. So the needs are enormous, and we hope that the people who come out of these programs will be quite ready to help fill these needs. Finally, after a long period of time, the funding is now really growing rapidly to provide jobs for these kinds of positions. So that, of course, is an important component, and that's good news over the last few years.
Okay, I do have one more question here on the Q&A, but before I go to that, Charette, do we have any questions on the line?
No questions at this time.
Okay. So it looks like the last question, Dr. Riegelman, before we go over to Kay, what is the workforce landscape for graduates of AS degrees and BA degrees in health navigation? Who is hiring, and what are the job titles?
Well, there are over 100 job titles, but those are the three big ones that I refer to: community health worker, patient navigator, sometimes called healthcare navigator, and health insurance navigator are three very specific ones. And the funding sources for those are also growing rapidly. They're often the hospitals through the Medicare readmission rule. Medicaid is providing funding. The ACA has specific funds. The community health centers are finding positions. So that's a short way to tell you that things are growing and there are jobs out there, and hopefully that will not be the issue in terms of the development of these programs.
Great. Thank you, Dr. Riegelman. I think at this point we are going to turn things over to Kay. I'm going to introduce her here in a moment, but first, similar to the first poll question, this question is specifically regarding a course. Does your institution currently offer a health navigation course? And again, using the feedback button, which is on the right side of your screen, you click that and can select yes or no from the drop-down there. We would love to know how many of you are actually teaching, or if your institution offers just a health navigation course. So now at this point, I'm going to, while you're answering that question, I'm going to introduce you to Dr. Perrin. Kay Perrin, let me just turn the slide. Dr. Perrin, since 1990, has held faculty appointments at the University of South Florida College of Public Health, specifically within the Department of Community and Family Health. And prior to obtaining her PhD, she worked as a registered nurse in a variety of public health clinics and hospital settings for over 15 years. Currently, Dr. Perrin is an associate professor and assistant dean of undergraduate studies, where she oversees all aspects of the Bachelor of Science in Public Health. She teaches undergraduate and graduate level courses. She also consults with hospital boards related to patient readmission data and patient navigation policies. In her personal life, she was the patient advocate and end-of-life caregiver for her parents and husband. Dr. Perrin is the author of 3 books from Jones and Bartlett Learning: Essentials of Planning and Evaluation in Public Health, which is part of the Essential Public Health series that Dr. Riegelman was talking about, Principles of Evaluation and Research for Healthcare Programs, and then finally the forthcoming book that she's just finished writing that we're going to launch this or release this summer, Principles of Health Navigation, Understanding Roles and Career Options. So with that, I'm going to now turn things over to Kay for the presentation.
Thank you very much, Sophie, and thank you, Dr. Riegelman, for the very good overview of exactly what's going on in the field of health navigation, which I look at it as I think we're just on the absolute edge of the real expansion of this whole concept. So the Principles of Health Navigation book that I just finished, I mean literally just finished, December 15th, is a comprehensive overview of mostly the whole idea of health navigation. We're not trying to do the details in this book because, as Dr. Riegelman showed you, we're going to have 3 to 4 other books. So I was trying to introduce concepts and the general overall theme of the principles of health navigation instead of going into great detail. We also, as he mentioned, the initial market is at the community colleges, and the different titles of patient navigator and community health worker, and then you can go even deeper into that, such as the insurance navigation, pediatric navigators, all of those things will come over time. So this is just the first overview book that will be used. The book includes 3 parts. The first part being looking at and really outlining for the student, if it's possible to do this as an overview, because as Dr. Riegelman said, that as we all know, the healthcare system and the insurance component of the healthcare system is really very hard and difficult to understand, but we try to break it in this book very, very simply so that the health navigator gets an idea not only of the complexity, but also the insurance and how important it is for them to help people not only understand it themselves, but then turn around and be able to help other people navigate through the system. Then there's part 2, which is the care of the individual, which I'll go into in a little bit, and part 3, analyzing and looking at health information, which is also tricky in the internet world that we all live in. So part 1, we start with an overview of the history of what was then called patient navigation, now called health navigation, a more comprehensive term, looking at the whole prevention through the lifespan. So we cover not only primary, secondary, and tertiary, so they get an overview of that whole concept, core and essential functions, disease surveillance, and then, of course, different healthcare institutions, which, as I was writing the book, I will share with you that, you know, when you think of just healthcare institutions, you come up with one list, and then you think of one more, and you think of one more, and you think of one more, and it becomes a very large list of healthcare institutions. The other thing I want to mention throughout the book is I used case studies and case scenarios and student activities. Keep the community college students not only, and the undergrad students, not only engaged, but I also realized that they may not have a lot of experience with the healthcare system. And so I wanted to use case studies that they could relate to. The other thing I do throughout the book is introduce medical terminology, not as a glossary, but in the case studies, so that I use words that are medical terminology, but I define them right there so that they are never totally lost. And as they read through the case studies, they become more and more familiar with medical terminology. Another part of the first part of the book is healthcare personnel. I want the student and the health navigator to really begin at this basic course to understand that they are part of the healthcare team. They are not an add-on. They are not something that you use as, you know, when all else fails, let's call in the health navigator. We want to have the student realize that they are part of the healthcare team, whether it is at the very beginning, looking at the ACA website, navigating health insurance, to using health insurance, and then to follow up with maybe after discharge, to be that, as Dr. Riggleman said, to blend the community, the patient navigator roles together so that they can keep people from getting readmitted. Do they understand their discharge orders? Do they have what they need at home to be successful at understanding that? And we'll go into that in a little bit in a couple of minutes. The different parts of health insurance, everything from the ones that we all know, ACA, and then the whole soup of acronyms, HMO, PPOs, TRICARE, SSI, disability, workers' comp. The list just goes on, and I try to weave those into case scenarios so it's not just a list to merely memorize, but to have an understanding of how somebody could be on Medicare and Medicaid at the same time, how they could be on Medicare and Social Security disability at the same time, how their copay or secondary may be their spouse's insurance after they're on Medicare. So we all know that this is very complicated. I try to sort that out as easily and as simply as possible. And lastly, of this section, looking at the inpatient versus the outpatient facilities, again, looking at the lifespan. Are we trying to be the patient and health navigator for the new mom, perhaps going home after a child has some complications, all the way through hospice, whatever that entry would be at any point, so that they get the concept that the health navigator fits into a lifespan vision, and you're not just working with a specific population such as the elderly. The second part of the book goes into care of individuals, teaching the health navigator not how to take a history and physical, but how to learn the medical terminology if they're looking at the electronic medical record in a hospital or in a clinic, to really understand what is it about that they need to at least be aware of. For instance, is the person speaking English as a second language? That's something the health navigator would certainly want to be aware of. Looking at the determinants of health and the health disparities and the social determinants, to get the big picture, even if the health navigator is looking at the person's zip code and seeing, okay, I know what that zip code is, I know that neighborhood. That's going to give me an idea of maybe something that I need to be watching out for. I need to give them bus routes. I need to give them, you know, access to Medicaid or Medicare taxi services, those kinds of things, to get them involved. I put in a section on infection and chronic disease. I realize that some of these students, it may be new for them. I also know that they may have taken an anatomy and physiology class at the community college, and I don't know about the rest of you, but I think that a review of infectious disease and chronic disease is really, we can't emphasize that enough. And so it will be a review for some, and I think that it will be new information for other folks taking this class. So I did keep one chapter on that particular topic. We also want to look at quality of life and end of life. So there's a discussion about what's the difference between living wills and advanced directives, what is a health surrogate, what is a guardian ad litem, all those kinds of things that they need to know the terminology, but again, I tried to put that in case scenarios so they could relate to it, perhaps because of someone they know, because of a relative, or just to go, wow, you know, one of the things that I included in that chapter is a living will, an entire living will downloaded, so that the student can say, oh, I don't have that, maybe I need to do this, and open up a conversation perhaps with their own family about end-of-life decisions, so that's there for them if they chose to do that. There's a section on health literacy, defining what health literacy is, health communication, and looking at health outcomes versus listenability, not just readability, but also how is the care provider, including the health navigator, are we speaking at a health literacy level that will lead to understanding and, most importantly, compliance. It's very common that if you don't understand, you merely nod and look away, and we're thinking, okay, you know, I think the person got it. I have a section in there about return demonstration. If you are sending someone home, and do they really understand how the wheelchair folds up? You know, just basic things so that you can say, is it possible for the caregiver of the person to navigate? Do we need to measure the width of the bathroom in the home or the mobile home that they have? And is this person going to be able to work the equipment in their own home? So those kinds of questions that health navigators would want to look at. Lastly, we have a health information section, and that's just to let the health navigator realize, you know, what is the difference between .gov and .edu and .com and .net? What is reliable? What can the person who has questions, if they're looking for valuable information, are they going to find it on the internet? And most importantly, to go back to the health literacy and to look at a website, any website, we'll just pick WebMD. What is the health literacy level, and are the people really going to understand it? Are we sending people home with information that they may not understand, which is going to boomerang them right back into readmission? And we really want to teach the health navigator that they have a really important role in not only looking at health information and assessing it for themselves, because they are also learning the system as we all are at all given time, is then how do you explain that to the person that you are working with, whether it's the family, the patient themselves, or perhaps the caregiver. So what is evidence-based practice? What does that mean? What does being part of the decision-making role mean as a caregiver and as a patient, that you actually have choices in that? And then lastly, looking at health records and understanding all portions of whether it's their prescription or their follow-up appointment, just to make sure that they understand that completely. That would be on this slide of the diagnosis, the testing, the screening, the treatment. You can't expect folks to be compliant if they don't have a basic understanding. So we really want to emphasize how the health navigator fits into that team approach for clinical practice, whether it's at a community worker or a patient navigator in a hospital. Lastly, the role of the health navigation professional is that they, I hope, would have a bit more time to listen to the patient than the provider or the clinic nurse or the nurse at the hospital doing the discharge planning, and so that making sure that it makes sense to the individual. Increase compliance through the understanding of the health literacy, improve health communication, teaching patients how to ask questions, and continuing to ask questions even if it's merely to say, I'm really sorry, but I still don't understand. And then lastly, to serve as a liaison between the patient, the caregiver, and the healthcare provider at whatever level that is. But really, one of the things that I really want to emphasize about the book is teaching the health navigator to be that patient advocate, to be that person that's saying, I don't know the answer, but I will find out and get back with you, and they have the time to actually do that. I think that's an overview of the book, so I'll turn it back to Sophie.
Great, thank you, Kay. And we will now, I see we're right at 3 o'clock, so if folks still have time, we do have a few questions that have come through. I think some of these might actually still be for Dick, some questions just related to generally the associate degree program. Let me just advance the slide.
Sophie, do you want to tell them about some of the Johnson Bartlett resources too?
Yes, absolutely. Let me just grab controls here. We have a number of resources available. Before I read out these questions, I'll just mention these resources available on the website healthnavigationseries.com. That includes the guide to public health and health navigation education. There's also the community college and public health, the final report. Lots of other resources available there. When I send around the follow-up email, I will include links to all of those resources, and you can, of course, respond to me with any questions you have, as well as a request for further resources. But let me now turn to the questions, and if there are further questions, I would just remind you, and let me back up to this slide, that you can press *1 to ask a question, or you can use the chat box or the Q&A. Let me scroll down now to this question for Dick, which is, let me see, where did it go? Could a bachelor's degree focus on the health navigator role? It sounded like it would be more likely a certificate or associate degree, but can this be part of a bachelor's degree for students who have already completed an associate?
Right, that's a very good question. The initial program that you'll see in the report and the guide is focused on associate degree and on academic certificate programs, which might be added on, for instance, to a nursing degree or to other kinds of allied health professional degree. So that it's originally designed as a applied associate degree. However, the Society for Public Health Education, Sophie, which is very active in the health education at the bachelor's degree, is working on the concept of being able to transfer that degree to a health education bachelor's degree. So we hope as this evolves, and this is hopefully will be, you'll have much more information on this in the next year, is that as these degrees evolve at the associate degree level, and that there will be opportunities to transfer them particularly into health education bachelor's degrees, which, as you see from that graphic, is one of the really rapidly growing areas within the bachelor's degree programs.
Great, thank you, Dick. There's another question here. Has there been resistance of the navigator role from other disciplines? For example, do case managers, social workers, or occupational therapists feel their scopes of practice is being challenged?
That's another very good question. I think what we're seeing is that there is a big distinction. Case managers usually are master's degree, sometimes bachelor's degree, and often require a nursing background, sometimes a social work background. So that I think that there is some anxiety, but I think it's going to be being worked out really quite well in terms of complementary roles. And but there is evolution going on. There aren't as there are more and more people who are trained in health navigation, how will they work as part of a team? And that team will include physicians, it'll include nurses, it'll include a whole variety of people from occupational and physical therapy to pharmacists, and there is still a lot ahead to be sure that everybody on the healthcare team understands the role of health navigators and incorporates health navigators into that. And we hope that the education at the community college level will help that, because many of you have nursing programs and you have allied health programs, and that you can by having these health navigation programs closely related to these, I think at the educational level, this will become easier to do. So the answer is that this is a work in progress, and I think we are seeing, I think we're seeing some positive approaches to that issue.
Great. And before I wrap things up, I think I do have one more question through the chat box, but let me just quickly turn to Charette and see if we have any calls on the line.
There are no questions at this time.
All right, so one last question here before we wrap up the session. What kind of students will be interested in the health navigation program?
I can take that for you. I think that it is a wide variety of students. I see it as it could be an end point, or I could see it as being a starting point. So someone at the community college could do the health navigation AA community college degree and find employment. I can also see it being a pipeline into undergrad programs in public health, or even a stepping stone into a possible nursing degree. I think that it could be anywhere from young students to older students. I also see it as a stepping stone for someone that is perhaps has years of experience being a certified nursing assistant. So I think it really covers the community college student population extremely well, because it allows them to enter into the health navigation profession at where they're at, not only in age and education, but also as a springboard into what a variety of careers. And the one thing I also really found out about this as I was investigating the book is that there's a career ladder in this, and I think that that is just a very valuable tool for students to realize, as opposed to, you know, some other degrees that we offer, not only at the community college but at the university level, which does not have a real clear designated career path and career ladder for these students. So I think there's major advantages to that.
Great, excellent, thank you, Kay. Well, that's it for questions. So I will begin to wrap things up at this point. I would like to point out that all of the textbooks that were discussed today, at least the ones that are available, of course, we're happy to send complimentary review copies to you if you'd like. And I have on screen here, this is our fantastic team of account managers. You can find your state. They're very knowledgeable about Kay's book, as well as the Health Navigation series and the Essential Public Health series. So any questions you have, they can answer. I'm also happy to answer questions. So please don't hesitate to reach out to them. Dr. Riegelman and Dr. Perrin have also offered to answer questions, and their email addresses are on screen. You can feel free to email them directly, or again, you know, when I send around a follow-up email, you're welcome to just reply directly to me. If you have a question, I can send it along to either Dr. Riegelman or Dr. Perrin. And again, I would encourage you to visit the Health Navigation website, www.healthnavigationseries.com. It's just gone live. There's lots of great information and resources there already. There's a link to several of the documents that Dr. Riegelman spoke about. I encourage you to continue to visit the site. We're going to be expanding it over the next year as each of the titles in the series, over this year as well as through 2017, as each of the titles in the series are released. But in the meantime, we do have lots of printed resources that we're happy to share with you now. And as I mentioned at the start of the session, I'll be following up with the full set of slides. The recorded session should be available later this week, and that'll be a separate email. So at this point, I'd like to start to wrap up the session, I just want to say thank you to everyone who's joined us today, and thanks for your thoughtful questions. Thank you to Dr. Richard Riegelman, Founding Dean of the Milken Institute School of Public Health at George Washington University, for your very informative presentation. And thank you also to Dr. Perrin, the Assistant Dean of Undergraduate Studies at the University of South Florida College of Public Health. So with that, I will go ahead and end the session. Charette, if you can go ahead and close the line, that would be great. Thank you, everyone.